was well received. The doctor who was handling me, Dr. Prasad, did a very splendid job. In fact, I've taken the shortest time possible than what I had estimated initially, and I want to thank God for that. When I came, the procedure was done, and I liked the professionalism which was exemplified by the people who handled me, led by Dr. Prasad and the nurses who attended to me. The hospital is ranked high, in my view, in terms of its service delivery. The personnel who are handling patients, the way they talk to patients is quite good. The facility itself is very clean, and I even like the security arrangements which are made in the hospital. I've been here for the shortest time, and I want to say the services I've got are actually world-class services. The treatment plan went on very well, and the doctor would always share it with me. And where I was in doubt, we would always discuss and he would explain the items one by one in a very sober manner, which I could understand. I'm very, very much grateful for the work you people are doing at Cytecare, and I would not hesitate to recommend this facility to any other patient I come across.
So it's a pleasure to see Mr. Willis do so well in his autologous transplant journey, and I'm happy to be a part of his treatment. So his diagnosis, when you talk about multiple myeloma, it's a disease where an autologous transplant comes in the treatment of most of the patients if they are fit for the same. So the key time of referral is important. The patient should not become sick before they can go for a transplant. So Willis came at the right time. Another thing is that we were able to do the procedure so well was his attitude towards the treatment itself. Actually, Willis and his wife were so positive about it. They followed all the instructions, and in fact on the post-transplant on the 5th day when I was going for rounds, they were dancing actually. So this actually helps the relative staying with the patient and supporting the patient through the journey. And talking about autologous transplant itself, I think any type of transplant is not an easy thing to go through. There is high dose chemotherapy involved. There is a risk of infection. So it is always nice to see that a patient who has come from another country has gone through a treatment successfully and is going back well now. Thank you.
It is expertise on the part of doctors, on the part of laboratory team, on the part of blood bank personnel, on the part of our pathologist, and specialized nursing care for those who have been trained in bone marrow transplant. So not only the specialization is required for the treating physician, treating oncologist, the specialization is also required for the nurses and for the blood bank people who take specifically the stem cells, they harvest stem cells after giving specific injections, where the bone marrow cells are brought into the peripheral blood, and just like a blood donation, we take the stem cells, harvest it and keep it in a freeze chamber, and then we give a high dose chemotherapy usually, and then we transplant the harvested stem cells back into the patients. So this is a specialized procedure, and the Cytecare Cancer Hospitals team, not only the team of the doctors, the nurses, as well as the blood bank officers and the pathologists are specially trained to carry out the bone marrow transplant safely and reliably, and that is where our expertise is. And the contribution of the whole team is essential for success of the transplant procedure. As you can see in this video, one of our patients who did extremely well with this transplant procedure, both the patient and we are very happy with this, with the outcome of this transplant.